today we're going to be doing an injection on Sam, and she has problems with some TMJ clenching, and her masseter muscles are tight and firm, causing her some discomfort. And so we are going to be using Xeomin, the pure toxin, today to try and relax these masseter muscles on her. So I went ahead and mapped out, had her clench down, and found her masseter muscle here through palpation and mapped out where that is. You want to be careful when you are injecting the masseter. It is a larger muscle, but you want to be careful that when you inject, you're injecting in the lower parts of that masseter muscle. Can you go ahead and clench for me again, Sam? So when I feel and palpate her masseter, it's pretty firm, and it's up all the way up into here. I can see my marking is here. My pencil's kind of thick, but when I inject, I'm gonna be angling my injection down into the muscle this way, and I'll probably be coming down into here and then up through here. We want to try and avoid the rosarius muscle. If you inject that, then you're gonna affect her smile. And the same on this side. And then coming up here into the temporal area, so when that clenching, go ahead and clench for me, you can palpate this muscle up here. So they also often get quite a bit of tension up here with that clenching at night. So I kind of have marked some areas, and here we'll do some small injections up here to try and relax that area as well. We did a brief injection before, went super conservative, and we got a little bit of minimal relief out of it, but we're going to inject more today. It's quite a large amount of botulinum that you usually inject into those areas. 30 units, you can go up to, sometimes there'll be 60 units depending on how large and intense that muscle area is. In this area, I'm just going to be doing 4 injection sites and just doing 2 units in each of these. This is my first time injecting Sam in this area. And I'm just going to go low and conservative in this area today to see how that area reacts. If we need to add more, we can in about a week or so. And then I'm going to be doing 25 units on each side here, since I've already injected one time prior, and see how she does. She did get, like I said, some relief. This is a stronger side for her, and but when I palpate, they both equally feel thick and about the same. So that is what we're going to do. We've already cleansed her face and disinfected with alcohol, so we're going to go ahead and inject. Again, I tend to, when I draw up all of my needles ahead of time. I don't like to draw all in one single syringe, so that my needles stay sharp and it's more comfortable for the patient. I'm going to turn your head this way, Sam. And I will tend to bury the needle in this with this one. Comfort level was 0 to 10.
I'd say probably like a 1.
I tend to, when I inject, I often want to inject away from the area that I want, maybe if the neurotoxin is going to travel at all. I want to inject away from that area that I don't want it to travel to. That one.
Good.
0 to 10?
That one was actually probably like a 0.
Okay, good. We like 0.
Yeah.
I'm just gonna come up from behind here and make my workings. We'll have you follow up in the next 7 to 10 days. We'll kind of see how you're doing. Just gonna apply a little bit of aloe here to calm those areas down on the surface. Avoid any heavy massaging. Workouts. Stay upright for the next 4 hours. So also, neurotoxins in this area can be used for, we talked on my last session a little bit about using Xeomin for therapeutic reasons, and this is more of a therapeutic reason for her. But also, you can inject the neurotoxin Xeomin into this area for a jaw slimming area, so people who have more of a square jawline or a larger masseter area, you can use the Xeomin for an injection in this area to kind of thin out this jawline area, so it'll reduce the size of that masseter muscle, giving you more instead of that boxy face, more of that heart-shaped face. So we're seeing that used more and more for that. It is a larger unit size, so as far as financial investment, it is a little bit of a larger financial investment, but the results are quite drastic, and most are very, very happy with it. And again, minimal side effects, and it's a non-invasive procedure. So, all right, we are done.